Medical revalidation of Puerto Rico. Clinical questions on muscarinic agonist, M2 receptor. 1. A 65-year-old man is given a muscarinic agonist that selectively stimulates M2 receptors. Which of the following effects is most likely? A. Increased heart rate. B. Decreased heart rate. C. Increased blood pressure. D. Bronchodilation. Answer B. Decreased heart rate. Explanation. M2 receptors are primarily found in the heart, SA and AV nodes, where they inhibit adenylate cyclase, reduce CAMP, and slow heart rate, negative chronotropic effect. 2. A researcher is studying the effects of an M2 receptor agonist. Which of the following cardiac changes is most likely to occur? A. Increased conduction velocity. B. Decreased AV nodal conduction. C. Increased contractility. D. Increased ventricular filling pressure. Answer. B. Decreased AV nodal conduction. Explanation. M2 receptor activation reduces AV nodal conduction, leading to prolonged PR interval on ECG and potential bradycardia or AV block. 3. A 45-year-old patient with symptomatic bradycardia is given a muscarinic antagonist. Which receptor is being blocked to increase heart rate? A. M1, BM2, C. M3, D. M4. Answer. B. Explanation. M2 receptors in the heart decrease heart rate. Blocking M2, e.g. with atropine, increases heart rate and AV conduction. 4. A 72-year-old man with heart failure is given an M2 receptor agonist. What is the expected effect on cardiac contractility? A. Increased contractility. B. Decreased contractility. C. No effect. D. Increased preload. Answer. B. Decreased contractility. Explanation. M2 activation reduces CAMP, leading to negative inotropic effects in the atria, but minimal effect on ventricles. 5. A patient overdoses on pilocarpine, a muscarinic agonist. Which of the following is the most likely cardiac effect? A. Tachycardia. B. Atrial fibrillation. C. Bradycardia. D. Ventricular fibrillation. Bradycardia. Explanation. Pilocarpine activates M2 receptors, leading to reduced SA node firing and slowed heart rate. 6. A patient receives an experimental drug that enhances M2 receptor activity. Which of the following side effects is most likely? A. Increased heart rate. B. Dry mouth. C. Hypotension. D. Pupil dilation. Answer C. Hypotension. Explanation. M2 activation decreases heart rate, reducing cardiac output and possibly leading to hypotension. 7. Which of the following drugs is most likely to counteract the effects of an M2 agonist overdose? A. Atropine. B. Propranolol. C. Metoprolol. D. Acetylcholine. Answer. Atropine. Explanation. Atropine is an M2 antagonist that blocks muscarinic effects, reversing bradycardia and AV block. And 8. A medical student is reviewing the effects of vagal stimulation on the heart. Which of the following best describes the role of M2 receptors? A. Increase AV nodal conduction. B. Reduce heart rate. C. Increase cardiac output. D. Increase stroke volume. Answer. B. Reduce heart rate. Explanation. Vagal stimulation releases acetylcholine, activating M2 receptors, which reduce heart rate and AV conduction. 9. A patient with organophosphate poisoning presents with bradycardia and hypotension. What is the first-line treatment? A. Neostigmine. B. Epinephrine. C. Atropine. D. Propranolol. Answer. C. Atropine. Organophosphates inhibit acetylcholinesterase, leading to excessive M2 activation, bradycardia, hypotension. Atropine blocks muscarinic receptors, reversing these effects. 10. A scientist is studying M2 receptor blockers. Which of the following would be an expected effect of an M2 antagonist? A. Decreased AV conduction. B. Increased heart rate. C. Bronchoconstriction. D. Increased saliva production. Answer. B. Increased heart rate. Explanation. M2 blockade, e.g. atropine, increases heart rate by removing vagal inhibition on the SA node. Key takeaways for medical revalidation of Puerto Rico. M2 receptors are found in the heart, SA, and AV nodes. M2 activation, decreased heart rate and AV conduction, bradycardia, AV block. M2 antagonists, e.g. atropine, increase heart rate and AV conduction. Overactivation of M2, e.g. organophosphate poisoning, causes bradycardia and requires atropine.